I would say almost every doctor that I went to just ruled that out entirely.
There's just resistance, yeah.
Yeah. It takes a toll on not on the person, not just like physically, but like mentally too, because it affects your brain, so it affects concentration, and it affects like anxiety and anger, and it affects everything.
They don't want to talk about it.
When you're surrounded by someone who's constantly like all over the place, it makes everybody crazy.
It's been a tremendous burden on the entire family. Everyone needs to pitch in and do their part to help the person that has it. There's a lot of resistance even talking about it.
My name's Ariana, and this is my mom, Tina. I had fatigue, serious body pain, like muscle pain, joint pain, anxiety, headaches, migraines, hip pain, knee pain, ankle pain. And then it affected my brain, so it affected my concentration, like my school, work, and everything, my anxiety, concentration, my memory, completely killed my memory.
Yeah, there's something called brain fog. And,
oh yeah, I had that too.
Lyme brain fog that it causes.
It like puts you in this state of like you
feel
don't
like
know.
You're in a bubble,
you
right?
feel like you're in a bubble. You don't know what's going on. You're in a complete fog. So I had that. Fever, sweat, chills.
Yeah. Low-grade fevers at night that you just couldn't explain.
Yeah.
No doctor could tell us why. And a lot of the symptoms, if not connected by the dots by the right person and diagnosed, can be really talked away. You know, you can make up a situation for each symptom that it could be or it might be, and it just makes you crazy after a while.
Yeah. It took me 2.5 years to get diagnosed, and the process was insane. I was going to all sorts of different specialists throughout the Northeast, and they were all telling me that I was fine. I was being tested for everything, and nothing was coming up positive. So
we probably had five neurologists.
Yeah.
And we probably had an orthopedic, a rutaid arthritis person.
Yeah, but then I had like those random doctors that we were being sent to too. Probably like 30?
No, gosh, no. I would say
not 30.
Between 15 and 20.
I'm Tom Connors. I'm a pediatric chief resident at Mount Sinai Hospital in New York.
And I'm Courtney Giuliano. I'm also a pediatrician. It's a tick-borne illness. It's spread by deer ticks. So that's how you contract it, by getting a bite from a tick that's carrying the disease. Basically, ticks carry the bacteria, and then they bite humans and spread it that way. So the risk factors for getting it are living in an area that's
wooded
or with these ticks that are endemic to the area, and not taking precautions like wearing bug spray or searching yourself for ticks when you come out. But areas like the East Coast and Long Island are especially prone to patients with Lyme disease because that's where it predominantly is.
And mostly more common in the spring, summer, than fall because of the fact that you're out in the woods more often and you're more exposed as well. And we've also, the lifespan of the tick is more prevalent than in those seasons as well. So there are several phases that Lyme disease can present with. The most common that people think of is what's called early localized disease, where after you have a tick bite, somewhere between 7 to 14 days after the initial bite, you develop the classic rash, which is the bullseye lesion. And so that can appear up to 14 days later, and then that is considered early localized when you don't have really much other symptoms. You may have some malaise associated with it, and some other symptoms can develop after the rash, but that's the most classic for the early localized disease.
And in some patients, this early manifestation of the rash isn't necessarily picked up, and they present with symptoms a few weeks later that have become more disseminated and affect sort of more globally their bodies. And that's called early disseminated disease, and oftentimes it's just multiple of the same sort of rash that you see with the early localized disease, the target rash, but just sort of all over the body or more than one. Or you can have other issues with problems with nerves in the body, like facial nerve paralysis, or issues with heart muscles conducting properly. And those require also treatment with antibiotics when they're picked up.
The American Medical Association has put guidelines on treatment, and has a lot
And
to
how
do with the
long?
insurance companies and being paid for treatment. And some doctors just absolutely refuse to deal with it, so they do not want to
Won't
believe
acknowledge
that there is a chronic Lyme, so they'll tell you you're fine.
And so there's also, there's the late disease, which can happen much later, and then I think they could also be sometimes confused with people called chronic disease. And so you can develop symptoms and have symptoms persist for very long after you are initially diagnosed with Lyme, and you can have malaise, fever, joint aches, even after a successful course of antibiotics. And while I'm not entirely sure what the mechanism is, I believe it's attributed mostly to antibodies that are still circulating from your body's reaction to the Lyme itself. So there's really been no conclusive evidence that's shown that repeated courses of antibiotics will alleviate those symptoms.
When it hits the third stage, which is usually anytime after 4 months, I believe it is, it becomes late stage Lyme, and that's what makes it chronic, because it's already left your bloodstream.
So when I first started, it was oral antibiotics, and that was and then I went to the doctor once a month, right?
Once every 2 weeks.
Once every 2 weeks for blood, and then once a month for a checkup. And then that lasted for a year
and a half.
And then after that, I started intravenous IV medication for a year.
And we've paid a lot of out-of-pocket expenses that insurance didn't cover.
And it's really expensive for them to treat, so because a lot of insurance companies won't pay for it.
And the other point there is that they can lose their license by treating against the American Medical Association. Open your minds.
Say a lot of things.
I would say open your minds and start thinking outside the box, and please try and become forward-thinking doctors so that we can get somewhere with this disease. We're in the same place we were 25 years ago.
Be more knowledgeable. Just try harder to
educate yourself.
Yeah.
There's a whole Lyme community out there to support you and help you. You just have to find them, because your regular doctors are not going to offer that. Hang in there.
Yeah.
Hopefully they'll come up
stop.
with an absolute cure soon. I know there are research doctors working on it at Columbia University especially, and other universities are working on it. But go and seek treatment. Don't listen to your doctor if they tell you you're better and you still feel like you're not better when you're done with what they consider a round of antibiotics. Just keep going.
If you're still in pain, just hang
Find
in
a
there.
doctor that will treat you.
Yeah.